thank all of you for being here today. I'm incredibly excited about this dialogue. Our Senator Cory Booker has a quote that I like to borrow. If you want to go fast, you go alone. I think Mark something like this earlier. If you want to go far, you go together. I think that mantra is underscoring so much of our work in this food security space, is that, each and every one of you know this is a marathon. You know that we have a long, long way to go before we see the numbers recede to pre-pandemic levels, which were already too high before even the pandemic began. And we have even further to go before we comprehensively address the needs of our neighbors with dignity. And only through working together, mutually carrying parts of this load, honing into best practices, encouraging each other each and every step of the way, can we truly make an impact to end hunger in our communities. So that's why I'm super excited about all of these people who are on this panel today, and all of you who are committing to be here today to have this conversation and this dialogue, to be this collective voice and to highlight the needs that we're not only seeing on the ground, but how we continue to be partners in good health, as this conference is all about. So these entities who are before us are working regionally to make an impact, and I'm going to give each of them an opportunity to highlight a little bit of the work that they're doing so that we can have a platform and a base for the conversation that's going to continue. So why don't you start us off, Jen?
All right, here we go. So hi, everybody. I am not Mary Sellis. I apologize. I'm hoping that I can somewhat fill her shoes today, but she was pulled into another event, so asked me to come. The good news is, with the Passaic County Food Policy Council, we have a shared leadership kind of model, so hopefully I can fill those shoes a little bit. But the Passaic County Food Policy Council, I'm going to read this so I don't get it wrong, but our vision is to end hunger by addressing the root causes of food insecurity in Passaic County, bring together partners from across the food system, advocates for policies that make healthy food more affordable, accessible, and available to Passaic County residents. So that is what we do, and you can see it was in 2010 where the first kind of inkling of the Passaic County Food Policy started, Food Policy Council started. There was a hunger-free planning grant from the USDA. So how did we start? We started with a lot of needs assessment, kind of looking on what's going on in Passaic County, coming up with an action plan. We have some people in this room, maybe like Mark, who was involved from the beginning, and then kind of seeing where that took us. All right, so if we go to the next slide, you can see we have a, like I said, a shared leadership coalition structure. So the United Way of Passaic County is our backbone organization, all right? So that's where Mary is, and she started as the Health Equities Director, I believe was her title. She is now the Director of the United Way of Passaic County. So we do have a resident advisory board. So Mark talked a little bit about that this morning, about how to get engaged with the residents and what they want to see moving forward. Kind of that power ladder that he was talking about. Can I just yell? Is that okay?
Yeah.
So we do have that start. I said cross-sector leadership team. We have a steering committee. So we have some other folks in the room too that are on the steering committee with me. And we have working group chairs. So we do have that kind of, we're trying to do that collective impact, right? We want to take input from all different folks and make sure that we're not only United Way of Passaic County is doing the work, we have different leaders in the county doing the work, right? And so this is just a little bit on our working groups. So as people may know, our working groups change. So it's going to depend on what those residents kind of advise. It also is going to depend on where the funding is, right? So what can we find funding for, and what do we want to prioritize at that moment? So we're looking at local food procurement. We're looking at federal nutrition programs, outreach and enrollment, healthy food retail, community and school gardens, cooking and nutrition knowledge, and we do a lot of resource sharing and capacity building. Also, the United Way of Passaic County is the Emergency Food and Shelter Program funders. So for the county, so that helps a lot. You can learn a little bit more about us there. I do have Mary's email on there. If anybody's really anxious to get to her, I can give you her cell phone maybe. But that's my information too. So that QR code will take you to the Passaic County Food Policy website, Food Policy Council website, where you can see a lot more of our information.
Thank you, Jen. Thank you so much for that overview.
Thank you, Tracy. My name is Patrick Fallon. I'm the coordinator of the Bergen County Office of Food Security. Previously, I was with our Bergen County Division of Senior Services in the Department of Human Services. So I just want to tell you a little bit about where we started, the creation of the Food Security Task Force, and how we've evolved into this permanent office within the Department of Human Services, and what we're doing in that spot to help our network of food pantries from across Bergen County. So I'm sure we can all remember scenes like this from the beginning of the pandemic. It's one of my favorite pictures of Tracy hugging the bag of onions at an emergency food distribution. I think we were doing with the Community Food Bank. So really the creation of the Food Security Task Force was initially a response to the pandemic emergency. So many of you, I'm sure, remember just the crunch of people coming to your facility, serving more people than you'd ever seen before, and just wondering, what are we going to do? How do we dig out from this hole that we're under? So many more people coming in for assistance because they've lost their job for whatever reason. So that was first and foremost the mission of the Food Security Task Force, was to help stabilize that food supply, shore up the situation at our pantries in Bergen County, and get people in a place where we were able to meet that increased need, at least in the short term. These are some of the partners that were convened early on. As you can see here, we have a mix of food pantries, government, many of our departments, human services, health, different parts of county government, other nonprofit organizations within Bergen County. And this was sort of the steering group that was going to decide the goals of the Food Security Task Force going forward.
The whole point was to have representatives from the north, the south, the east, the west, small, large, municipal, faith-based, just so there was a sampler platter to really get an idea of what was going on around.
Yeah, and really just to get that understanding of, here's what's going on in different parts of the counties, and how can we as county government address these needs wherever they may be. So, as Heather mentioned, the task force was founded in 2020, spearheaded by Tracy, and also with the backing of our county administration, County Executive Jim Tedesco. And these are some of the initial goals. So we needed to respond to the immediate emergency, but after we'd stabilized the situation at the pantries, we needed to take some additional steps. So we truly wanted to create a network of providers. For so long, there were many food pantries that existed in Bergen County long before COVID, but it just made up this sort of disparate network of providers that were a little bit siloed. So we wanted to break down some of those walls, get people talking to each other, really turn these pantries into the hubs of social service that they are, and integrate them into the broader social services landscape here in Bergen County. We also wanted to improve the supply chain for healthy food options, which I'll get into in a little bit when we talk about our sustainability grant program, but making sure that pantries had the capacity that they needed to accept those items, freezers, refrigeration, things like that, making sure they were partnered with organizations like Table to Table and the Community Food Bank in order to get those fresh items, fresh produce, meats, dairy, cheeses, to be able to give out to the folks coming into their facilities. We also wanted to improve awareness about food insecurity in Bergen County. That's a challenge certainly that we have. People think Bergen County, and they're not wrong, it's one of the wealthiest counties in the United States, some of the wealthiest zip codes in America, but people face food insecurity in all 70 of our towns here in Bergen County. So we needed to use county government as a way to amplify that message and make sure that in all of our communities we were supporting the food pantries that were doing this great work. And then I think there was one more in there, but so just to improve the outcomes for food insecure families. Something we've heard a lot about today is going a step beyond just making sure people were fed. How do we treat the whole person? How do we make sure that people are getting all of the services that they need to sustain themselves and their families? And you'll see that's going to be a big point of emphasis for us sort of going forward and becoming the Office of Food Security. So how did we realize those goals? And we're still realizing them today, and we will be for years after this, I'm sure. But the first thing that we wanted to do is increase information at our food pantries about available resources and put them on a path to referring individuals and families to the relevant agencies to get them the services that they need. We've done this sort of formally and informally through things like our Bergen County Social Services Directory, which we've made available to all our food pantries in the most current version in English, Spanish, Korean, and Polish, to make sure that they're as inclusive as possible for people that may be coming to pantries in Bergen County. We also do it through things like our Lunch and Learn series, where we bring providers in monthly to talk about their services, what they have to offer, and allow pantry directors to ask questions, and learn a little bit more about what they do. I see a lot of people in the room today who I've seen in the little boxes on Zoom participating in those meetings, like Sue and Carmen and Karen and Chris and the folks from Center for Food Action. So thank you all for being a part of that. We also wanted to try and foster sharing of best practices and, again, work towards creating that true network of providers. We've done that sort of in a big way through our Bergen County Food Pantry Summit, which we have our 4th one coming up next month on June 25th. And we also do it a little bit more informally through food security office hours, where we'll just open a Zoom once a month. People can jump on for as long as they'd like to talk about whatever they'd like. Here's what we're seeing at the pantry. I have a question about this program or this grant, and really just source that information from their peers in the pantry space here in Bergen County. We want to modernize pantry operations by helping people get access to technology. That was a big thing through our sustainability grant program, which I'll get a little bit more in depth in a little bit, but also through the rollout of our countywide Oasis Insights Network. Those of you in the room who are community food bank partners may be familiar with that software, but we have our own network where we're trying to bring as many Bergen County food pantries into the system, so we have a better idea of what sort of that top line data, how many people are being served, how many food pantry visits are we registering across Bergen County. It's another tool for networking through the bulletin board, and we actually have the ability in the software to make direct referrals, of course with the client's consent, to outside agencies with the click of a button, to do that warm handoff, something that is so important to us, and I think really moves towards meeting that goal of moving beyond food, helping treat the other needs in someone else's life, and really leveraging what all of you do, again, as those true hubs of social services in the community. So this all sort of culminated last year when our county executive announced that we would become the Bergen County Office of Food Security, a permanent office within our Department of Human Services, which really is a great spot to be, because we are talking with our colleagues, myself and my colleague Ryan, who's here today, with our counterparts in senior services, veteran services, disability services, alternatives to domestic violence. We can just walk down the hall and have a conversation with these folks that have so much knowledge, so much information about these services and programs, and that's why it's such a great place to be within human services at the county. But we're still working towards some of these original goals. Like I mentioned, we're really trying to modernize pantry operations through use of this Oasis Insights software. We've distributed over $1.6 million in grants from our Food Pantry Sustainability Grant Program. It's also great to see a lot of people here in the room who have been multiple-time awardees from that program, hopefully with transformative results at your pantries. And we're continuing with the advocacy side of it as well. We know that that's always going to be a challenge in a suburban county, so we try to do that advocacy in a little bit of a different way through things like our Bergen County Super Bowl, where we pit rival high schools against each other to see who can collect the most cans, and then donate them to food pantries that they're choosing, through events like Bergen County Construction, which we just had at American Dream down in East Rutherford, where we had 4 teams from high schools and colleges in Bergen County. We hope to have Felician next year, by the way, so if anyone here is from administration, we'd love to get you signed up for that event. Build unique structures out of cans, which are also donated to local food pantries, just to frame this issue in a little bit of a different light, put it out in the community where everybody can see and sort of interact with it however they feel best. So that's a little bit about what we do. And of course, happy to answer any questions that people have when we get into the Q&A.
Good morning, everyone. My name is Adaobi. I am the Director of Health with United Way of Greater Newark, and I'm here with my colleague, Keily Hayes, who's the Director of Community Impact for MEND, and we represent the Food Health and Equity Coalition, also known as FEC, of Essex County. And we're fairly new. We were established in this year, but we're coming out the gate hot. Yes. So our mission, the mission of our coalition is to increase and improve food access, security, and sovereignty through collaboration, advocacy, education, and coordination of resources. And we envision a future where communities across Essex County have the access and ability to acquire the food and nutrition they need and want from sustainable food systems, which are informed and driven by the communities that they serve. So just some of our coalition goals so far. We hope to engage a diverse group of stakeholders, including the development of the Community Advisory Board, to identify the greatest barriers to food security impacting our communities in Essex. We also wish or hope to compile and assess existing food access resources in Essex County, and develop a plan to centralize, maintain, and share comprehensive, relevant, and accurate food access resources. We all know data is very, very important, so that's definitely something we want to target. And lastly, we want to build working groups to address the greatest barriers to food security in Essex County. And these working groups will include experts, professionals, as well as community members who have the actual lived experience. A little bit about how we got here. Again, as mentioned throughout the morning, really wanted to have a collective impact across different sectors. As we know, food insecurity is an issue that impacts different sectors, and will definitely require that in order to solve the issues. So we have, organizations with common agendas, shared measurements, continuous communication. We want to work with backbone organizations and have mutually reinforced activity. A little bit of background again on how we got here. So about a year and a half, 2 years ago, I know Ben was, in contact with a whole bunch of different organizations and asking about their, food impact work and how, just trying to pick their brain on how we can definitely establish something like that in Essex County. So thank you to all these organizations who helped us during that time. And by August 2023, these are on the left are the organizations that are part of the planning committee, and then to see a few months later in January, that more than doubled. So again, like I said, we're coming in hot, and I'm thankful to everyone who's been part of it so far. These are the different collaborations, the cross-sector collaborations. We have, organizations from healthcare, nonprofits, government, philanthropic, academic. So really, definitely, this is a really big collaborative effort within all the different groups within Essex County. And then lastly, we have our coalition structure. This is still moving parts, but at the top we have our Community Advisory Board and our Steering Committee. And then underneath that, we have some of our supporting groups, like advocacy and policy, resources, and data collection. And under that, we have some of our target populations, our working groups, older adults, maternal and child care, and environmental and sustainable practices. So again, those three supporting groups definitely, work within the other working groups as well and support them as needed.
I see so many familiar faces out here. Thank you. We are so excited to be here. We're like the baby coalition at the table. We've done a lot of learning. We're learning. It is so messy. I said in the Q2 meeting, the second quarter meeting that we had on the 9th, May 9th, 2 weeks ago, I said to the group, thank you for showing up again for our second quarter. We're asking the members to join in whatever capacity you can join, and a lot of people are saying, I'm so sorry I haven't participated. I'm like, it's all good. That's why we're a collective. So we're tapping into people's energy and expertise when they have it to offer, and that's how we hope to be sustainable. But yeah, we're 3 months on the books, so like Adaobi said. This also is our attempt to organize information and make it visually accessible. We are excited to put ourselves on the map as a county level effort. Recognizing that our membership has been doing this work for a really, really long time. So I think the hope is that there's a food policy council or coalition in every county of this state. I think Mark at the Office of the Food Security Advocate for doing so much work to convene these coalitions so that we can learn best practices from each other. We've done a ton of that, what's working, what's not working, who can do what. So you have counties that have something you want to add to this map, send it to us, we'll add it to the map. This is just a note to word clouds. We're trying a lot of things, and getting creative, but what the membership said when they were asked about the barriers they face in their everyday work as providers on the left, and then the opportunities that they see in this work. And I just love that increased community popped out as the big words there. This is just showing what we've done so far in our first quarter meeting and then our second quarter meeting. So the lineups of our quarterly meetings. We had 60 to 70 participants at each of the quarterly meetings, representing over 50 cross-sector organizations. Really great energy. We're really excited. So far, it's been a lot of gathering the data, establishing a common ground, understanding who's doing what and where we can fill in the gaps, where we can amplify things that are working, where we can fill in what's not working, or connect. We're getting a lot of questions asked, like, well, what do you actually do? And we're trying to figure that out. But we're having a lot of conversations, and these are some really specific things. One example is we know that our county has a wait list for Meals on Wheels. What can we do about that? Can we serve the line? Can we have a program that's serving those who are on the wait list until they're enrolled in the program? Right now, we're ideating. We're throwing all ideas on the table. We're not crossing anything off the list. So it's an exciting time for sure.
Do you want me to go back down?
Nope. We have a website. Pretty excited about that too. Don't judge it yet, but check it out. And we're just trying to be super transparent as we figure out this process as a brand new coalition. So if you want to know the login for the member password, I can tell you off mic. But it has the member list. It has everyone's contact information. We did a survey of who's doing what, so each person and what their current initiatives and programs are. We're just trying to put all the information out there because we figure that can't hurt. We're also developing some tools to measure our impact. So what does success look like is something we're asking ourselves all the time. And we're asking members to track their impact. So big and small, if you have a success story, we have a tracker and you can enter it in. So from April to now, we have 19 stories of impact. I think that's pretty cool. There's actually a few more that I haven't logged yet. But it's demonstrating that this is starting to work. If someone calls someone that they wouldn't have otherwise called, or invite someone to present to their community that they wouldn't have otherwise known about without this coalition, we're calling that a win. Collaboration-o-meter is another attempt at a tool. Don't steal it, Mark. I see you're excited. So, strongly agree that their ability to collaborate, working with others to address mental health equity, they're able to do that more often, more easily. We're only in the beginning, so I think it's pretty great that 19 people said yes, they strongly agree, 27 said they agree. Feeling good about that. We'll measure that over time and hope to see an increase. The different organizations currently in the steering committee. If you want in, we're in. If you're in, we're really, you're invited. And if you want any more information or you want to join, if you live, work, or play in Essex County, you're welcome to join us. Thank you.
Awesome. First of all, you talk about stories of success. I want each of you to share a story of success of why these coalitions, that kind of are a demonstrative of why these coalitions are important, and kind of steer towards the idea of like what you're learning and where your next steps are going in that regard.
Sure, I can start. So within FEC, I also shared the advocacy policy working group. And I would just think for me, again, we've only had 2 meetings so far, but just seeing the interest and impact that, having those individuals join the group, we had such an incredible conversation about, what we want for specifically Essex County and then the city of Newark as well. We were able to just kind of map out some preliminary goals for our working group. And advocacy and policy is so important because it kind of shows into every other working group that we kind of have so far. And so I think just that completing in itself, I would say, is a success story because, it's a heavy lift, and to get that buy-in is important. And I think, to me, I count that as a success.
Patrick.
So I just have two quick anecdotes. So seeing like the fruit of all the work you put in to build the network and get people collaborating. I think, like you said, it can be a very heavy lift, but when it works out, it's like the best thing ever, right? So one success story is they're both related to our Oasis network. So the first one is we have a bulletin board where pantries can just post about whatever they want, and oftentimes we'll see just the sharing of resources in real time moving throughout the network. Hey, I have all these reusable bags that I don't need, or we had a distribution and I have all of this left over. Does anybody need it? You know, seeing that happen in real time is so amazing, and you know, it really validates, I think, some of the hard work that we've put in to bring people to the table and help build those connections between our partners that didn't necessarily exist before. So that's one, and then the second one is resource connection, creating those improved outcomes and making it easier for pantries to connect with providers to give people the services they need. There's a pantry that we work with up in Westwood, Parkside Community Church, some of you may know it. They use Oasis, and they had a gentleman come to one of their distributions who got his food, but was just talking with the director, hey, I'm having all these dental issues, but I'm a veteran. I know there must be some kind of program that I qualify for that can help me. You know, I don't have insurance, I can't afford to go to the dentist right now, but I know there's got to be something that can help me because I'm a veteran. She got a release form from the individual the next morning, and she sent his information over to Veteran Services to say, you know, this person at this phone number has having dental issues, he's a veteran, you know, this is the information he's looking for. Next morning, he gets a phone call from one of our providers at the Division of Veteran Services, and they were able to run him through an intake, get him signed up to 2 programs that were going to help him with the dental issue he was having, and then run him through a full intake to see what other benefits that he might qualify for. So seeing that, and it's all sort of early stages, but we're hoping to replicate that over and over and over and over again, where someone's come into a food pantry, but they had something else that they needed, and they were able to get that help because they went to the food pantry, and the pantry knew, I have the ability to refer this person. You know, this might not be something that I do, but I know because I've been a part of these discussions and conversations that I can hand that person off, and I know that there's going to be somebody on the other end of the line that understands what that person's going through and is going to reach out to them and get them what they need.
So how many pantries and how many providers at this point?
So right now we have some new ones. So I think we're almost at about 30 pantries using the network for some combination of data entry and referrals and using the bulletin board. And we've been onboarding some new providers, so I think that's up to about 25 different options for referrals from food pantries for additional services.
Okay, Jen, what about you? Success story.
All right, so I'd have to go back to our resident advisory board and talking about the Breakfast After the Bell program in Patterson. I think using parents as advocates to really get involved in the school district and understanding that they hold the power. We partner really closely with Hunger Free New Jersey. She's our legislative liaison, we'll call her, to our steering committee, and she does updates, Lisa Fitz, I should apologize, does updates for us all the time at our meetings, but really helps us focus on what's going on and what we can bring to our county, again, trying to bring some more federal dollars down or state money into the county to see what we can do to get more funding. I think now we've already turned that into looking at summer meals, so looking at Patterson and having that connection and knowing that the Patterson food system, or food service for the school district, knows that they can come to our meetings, talk about what's going on, and then our network will get that information out to all the residents. Using our members as advocates is really huge in understanding that those people with those lived experiences help direct what we're doing moving forward is one of our biggest success stories, I would say.
Awesome. Now, UNO 6 might be too new for this next question, so maybe we'll start with Jen again. What lessons have you learned that have changed you to pivot something that you're doing in a different direction?
Okay. I have a note on this. Let's see what Mary told me to do. I mean, it all comes down to that resident advisory board, right? So it takes a lot for us. We started and we had all these organizations that would go and we could advocate for what the organizations wanted. But when you get those residents involved, those constituents involved with legislators to really understand that they hold the power, that was one of our biggest lessons, and we really put a lot of more stock into the resident advisory board through the years. We are looking for new members. If anybody's from Passaic County and knows any members, please let us know. But I think that's kind of one of the big lessons learned, and also being able to kind of pivot your priorities depending on what those residents say, and or, again, where that funding is coming from. So we've worked with agencies that had funding for the Healthy Pantry initiative so that we could look at the healthy pantries and or healthy corner store initiative. So using what you have access to kind of prioritize where you're going is very helpful too. Patrick?
So, although I was not with the task force at this time, this is an era of the organization that I'm sure Tracy remembers very well, maybe not so fondly, but I think early on we thought we were going to be, we're going to be actively distributing food. We're going to be filling that kind of gap at pantries, making sure that they're not running out of food before everyone has a chance to get served. And I think that we realized very quickly that that was not going to be our strength. That was not the value that we were going to add sort of to the space. So we pivoted kind of wholeheartedly into this, you take care of the food, we'll sort of take care of everything else mindset, especially when it comes to resource connection and service delivery. There are some pantries that have already embraced this, and a few of them are in the room, like the Franciscans, who do the VITA program every year, putting millions of dollars back into the community in Fairview with tax returns and doing ITINs for folks living there. And also the Meadowlands YMCA, who now is doing SNAP navigation at their choice pantry. But we understand that not everybody has the ability to do that. Many pantries are run all by volunteers. People have full-time jobs. They go to work and then open up the pantry at night. So I think we were very intentional in going out to these partners and saying, this is important. We're asking you to do more, but let us help you. Let us be the ones to bridge that gap and provide that information about the services and help connect the people that are coming to your pantry, access them more easily.
And that kind of tees up to my next question, which is, what is your advice to each and every person out in this audience about how they and their pantry can better connect with you so we can make this even more impactful connections going forward? Why don't you start it off?
Specific to food pantries?
It doesn't just need to be food pantries,
Okay.
but all of the providers and partners. How do you recommend the movement forward?
Okay. That's where it gets so messy in that beautiful way. So in my day job, I'm overseeing the two programs through MEND, and MEND is an Essex County-based hunger relief network. One of the programs is Pantry Partnerships, which supports 21 food pantries across the county. So doing a lot of what Patrick was saying, increasing capacity, resource connections. How can a pantry have fresh food if they don't have a fridge? So let's back the conversation up. So the programming part of MEND does so much of that. I think an opportunity for the coalition is to build the capacity because MEND can't do it all. So that's been part of the reasons that this coalition is kicked off. I'd say for any providers or charitable food organizations out there, it's just a matter of sharing your information with our coalition. I'm sure it is the same for each of the county coalitions, but just connect, and then we can add you to the various lists that we have going that are connecting people to resources.
So for us, we're a small office. It's just Ryan and myself. We're the team. So connect with either of us. Also visit our website, bergenfightshunger.org, if you want to learn more about what we've done and what we're doing now. But I would encourage everybody here, and it doesn't matter what county you're from, to work towards localizing these coalitions even more so. I know something that's going to be a big focus for us going forward is getting your municipalities to sort of buy into your success as well and be aware of your needs. On the county level, we can do a lot, but the people on the local level are going to know best about what the conditions are on the ground. And I think that's sort of a challenge to everybody here. Engage your mayor and council and local organizations and say, this is what we're doing. We're meeting this need in our community. we need your help. We need your help getting the word out, getting volunteers, connecting us with the local schools or Girl Scout or Boy Scout troop, things like that. That would be my challenge to all of you, to localize those relationships that they're building even more, all the way down to the municipality level, and get everyone in your community to really buy into your success.
Jen?
Yeah, I would say if you want to join the Passaic County Food Policy Council, it's very simple. Come here today. Or reach out to Mary. I would just also emphasize the collective impact. So understanding what everybody's doing, and everybody's at max capacity, right? Like, we don't have minutes to spare. So knowing who in your community can help you with that. My day job is doing nutrition education, so I go to Kumac. I think I'm going tomorrow to do lessons. You know what I mean? So seeing who can do the other work to help you provide services to your neighbors and kind of help that way.
And I think just recognizing we can all learn from each other. Trying to identify those best practices and use them whenever we can is so important. And I think once we have identified them and we're actively using them at all of our pantries and providers and different places in the community, then it's a little bit easier to have that unified message when it's like, we hear this is working someplace, well, let's try it in this community and let's try it here, and just working together to find the best way to serve people that are coming into our communities.
Yeah, it's like open communication. It gets really hard when your day is structured and your back-to-back meetings or gas distribution times. So just making sure you're having that open line of communication. I know it's so much easier sometimes to send an email because you're like, oh, I did it. I reached out. But you know what? You can solve that issue in 4 seconds with a quick phone call. You know what I mean? So being comfortable with different levels of communication and knowing how other people prefer to communicate.
Thank you all. I want to open now to questions in the audience. We have still a few more minutes left of our panel. Are there any questions from any of you? Come on, it's got to be questions. Carmine.
What does the panel feel moving forward of frontline organizations, food pantries, food distribution centers? What should the role be in terms of, and I know Patrick, you're big on this, in terms of wraparound services and the push toward being a more holistic solution for people dealing with food insecurity?
So I think it really depends on what your bandwidth is to do it. If you have maybe a larger staff, like Carmen, I know you have a large base of volunteers, or somebody like a CFA, you have paid staff to do some of those things. So just seeking out the information, like learning how to, walk somebody through a SNAP application, for example, something like that. Like if you're able to do it, we certainly would encourage you to try to do it at your pantry, because you're going to know your clients best at the end of the day. I'm sure that's something that we all pride ourselves on, is like really building that trust and getting to know the people that are coming in through our doors. So you could be in a really good position to work with somebody. It's like, well, you're having this issue. Well, I remember learning about these programs that, the county human services offer, or the health department, or municipal services. You can help direct them to the appropriate program. And it may be a little bit easier because, again, you have that trust, that relationship built up with them. And it may, coming from someone like you, it may go further than saying, look at this handout, like call them up on your own. Like that's really what we're trying to do, is like using you all as like trusted people in the community to help push these individuals towards the services that they need. But again, we know that that's not realistic for everybody, based off of the staffing and the number of volunteers and the bandwidth that you may have. So that's where I think we'd encourage you to like partner with your municipality, reach out to county government. We have people that do outreaches every single day of the week from our different divisions in human services, and they'd be eager to come out to any pantries that are interested to talk about the services that they offer, walk people through how to apply, things like that. So you don't always have to, don't think that you have to do everything yourself. You can rely on us in government, you can rely on nonprofits to come into your pantry and provide that information for you in sort of a very kind of low-key way that doesn't like set off the maybe red flags for people that are coming in, because we know it can be difficult interacting with government services for the first time. It's overwhelming. You don't know who to call or what you need.
But that's the beauty of Oasis.
Yeah.
That's the beauty of the whole program that we're trying to build, is to make that more seamless for everyone who's on the ground. So it's not all falling on your shoulders. But let's hear from Passaic County a little bit about what they're doing.
Yeah, I would say just making sure that you are a place that people can come to provide their own services. So again, if you have the bandwidth, great. If not, who do you call? And that's part of the coalition, is understanding who's at the county level, who's in your neighborhood, who can help with these different things.
Sue? Oh, sorry. Sue.
So the question that I have is that we're on the municipal level, and then we have the county level. Is there a connection between the county level and the state level, so that we know what's working and what's not working at the state level? So in other words, can we funnel? Is there a coalition that now brings the county representatives to Mark so that he can hear what's working and what's not working?
So, Mark, do you want? I know this is in the works. You want to just tell people about some of the things that you have going on with the convening of?
I mean, you guys can answer that first, and then I'm happy to fill in. Or do you want me?
Up to you. Well, Sue, just so you know, like something that we want to do is like regionalize some of these things. So like we're working closely with like our counterparts in Passaic and Hudson County, and we want to bring you guys in Essex into the fold too, to see like what are the needs regionally, and then bring that to the state. But
Having Mark on speed dial.
yeah,
Right?
it does help.
And then I'll say for OFSA, so we are the connection to you guys, and because we can't be everywhere, but we try to be, working through county level coalitions, and me emphasizing at the state, at both the governor's office and the legislature, you have to realize that counties are coming together and they're listening to community, and we have to listen to them. So we are purposefully trying to stay in contact with the county level coalitions and municipal coalitions, and then that allows me to advocate for you all at the state level. So 100% yes, there is a connection between what you all are doing and the state.
And he always picks up his phone. Or sends a start and text back.
That's
Yeah.
true.
You had a question?
Yes, hi, I'm Vicky Philippine with the Jersey Bee and also member of Beck. I had a question for the Bergen and Passaic County coalitions. What resources do you use or tools do you use to let the community know what you're working on, what you're doing, and what they may have access to?
Yeah, I was like, I can start. We do social media. It is not a huge proponent of what we do. What we have found is word of mouth is really what gets stuff out. So we use our resident advisory board as kind of that network to get the information out to what's going on in the county, however we can.
And for us, we're also big users of social media, just to get the word out about things that we're doing. On our website as well, bergenfightshunger.org, we do utilize ArcGIS software to provide some informative maps and other guides, so people can see what the levels of need look like in different parts of Bergen County. For us, like, we're a little bit removed from the front lines. Our clients, quote unquote, are really the pantry directors. Like, we'll obviously help individuals that reach out to us with connection to services, but we're relying on all of our partners to help get information about initiatives that we have, services and other things, that are really, really important. One thing that I think we're all doing recently is summer EBT, trying to push information about that program out to the community. So, with something like that, we made the information available, to as many pantries as we could cram onto one email, and said, here's a toolkit. If you have any questions, we can, reach out to the state and Hunger Free and J and sort of ask them. But, really trying to work with our community partners to help push that information out is something that we do a lot.
But we're also at every town fair, every community event, every harvest festival, and we're encouraging and rewarding our food pantries for doing the same, for being out there. We're kind of giving them subtle encouragements, extra gift cards, to go and be present so that they can be out more, prioritize that community engagement. I mean, we love, we do the press releases. There's not enough press coverage of this issue. Too many people feel like, okay, there's not lines around the building anymore. Oh, that's because we've built pantries in the Meadowlands Y, and they only do the once a month food distribution. The need is still so tremendous, but the press attention has waned. So, that is something that we're constantly striving to do, is get more, attention. That's why we did construction. That's why we did Super Bowl, to get the word out that this is a pressing need for so many in our community.
And I just want to add, I think social media definitely is going to be a tool, especially as we move forward, to be able to do that, to be able to increase engagement. I know it's hard to talk about capacity, but I think that's going to be something that we need to lean into. I remember at the height of the pandemic, I was constantly seeing on my social media food distribution pop up, vaccine pop-ups, and that was through social media. So I think that's something that we're going to try to definitely tap into.
Yes.
Hi, I'm Christine. I'm also with MEND. I have a comment and a question, and the comment is, I would love to pick your brain about improving the supply chain for healthy food, so I will see you later, Patrick. The question is about the resident advisory board, thinking about that latter slide that Mark had. How has the advisory board influenced and shaped your coalition?
I would say that one of the major things is, with the resident advisory board, we all know that hunger is an issue, right? But what they came to the table with was emergency food providers, and I apologize to all of you here, are not the resolution, right? We need healthy food retail in our communities. So that was one of the big pushes for the Healthy Corner Store initiative, 2016, kind of big thing. So that's where you really get to hear, and obviously we all know, like, oh, we're all organizations, we work in the county, we know what's going on and what is needed, but when you actually hear what the resolutions or solutions that the residents come up with or where they want to move towards, it really helps drive your work